Over the past few years, the five-step method has become a very useful tool, popular with those delivering it, and very well received by the family members that have been helped by this approach. Jim, what would you say are some of the more fundamental things about the five-step intervention?
Well, I think the key thing for me is it's based on a psychological view of coping with stress. So we see an alcohol or drug, or indeed a gambling problem, which is rather similar, as very like other severe life stressors. So it's something that could occur in any family. Indeed, it could occur to any one of us. I think an important thing to say about the approach is that it takes a positive view of families. So, for example, in no way does it take the view that family members are the cause of this kind of problem. In fact, quite the contrary. The view is that they're a positive part of the solution to the problem. But we also recognise that family members actually can benefit from help and support in their own right, irrespective of whether the person they're worried about is in treatment or not. Irrespective of that, they can get help for themselves. And I think it's important to say that we take a positive approach, because in the past, approaches to family members affected by such problems have not always been positive. In fact, some of the approaches have actually been rather negative. I'm afraid it's been the case that a lot of people have not had a good, effective solution, a good, effective professional response. And this is a very common problem. It affects many, many people.
Yeah.
And I think, for me, some of the other great things about the five-step approach is that it's brief, it's flexible, and it's straightforward. And over the years, we've trained so many professionals from a range of settings to deliver the intervention, and some of those people aren't even specialists in this area. And all of them have been able to use the intervention with a range of family members, including partners, parents and siblings, anyone who's concerned, really. And the method can be delivered over 5 meetings, or if circumstances or time dictate, it can take place over just 1 meeting. And I think some of the feedback that we've had from family members and from practitioners is so overwhelmingly positive that I think, for me, all of these things combine to kind of make it such a popular approach.
Another advantage of the method, as mentioned by Lorna, in terms of the brevity and the lack of complexity, is that it has allowed us to deliver it in different formats, and the self-help manual and the web format, and at this with encouraging results. In addition, it also allows us to deliver it in different cultural contexts. It's nice in the sense that this lack of complexity allows it that it can be applied in less resourced countries that have challenges in funding healthcare. You find out that the components of this intervention allows it for delivery in these cultures. And for instance, when you talk about the strategies of coping, it takes the workers to be aware of these differences in the application, but the methods that they will use are generally the same. So you find in countries like Mexico, where you have large households or extended families living in small households and limited space, they have different issues of coping, which is slightly different from those that are within the UK with smaller family units, but the methods that will be used will be generally the same.
Yeah, these are all very important points that you're all raising. I'm thinking a bit about training. Richard, what would you say are the important things to think about in terms of training people to deliver the five-step method?
We've found there are perhaps 3 really important things about the trainees, the people who we're going to train. The first one is that they really have to have a positive attitude towards working with family members. The second one, which relates to that, is that they've got to think about alcohol and drug and, as you say, gambling problems as not just affecting an individual, but affecting the whole family. And the third point is that they really need to be familiar with the model, so familiar that they can use it in a flexible and adaptable way, because that thing about it being flexible and adaptable is perhaps the most important thing. I think we've found with training people that if people can adapt the model in this flexible way, then almost any family member and we've worked with a wide range of different sorts of family members, and any way they present can be used. We can use this model with them. So even in really difficult situations, for example, if there's a risk of physical violence or a risk to other family members, we found that the 5-step intervention offers an opportunity to, on the one hand, identify those risks, but also to respond appropriately in a way that keeps the family safe. So a relatively simple, or a model that appears simple to the people who we train and to the family members when we work through it with them, and one that's very flexible.
Just to summarise the 5 steps, I think it might be useful at this stage. We developed the model so that it's in 5 steps. And the first step is very much about hearing the family member's story. And it's a story that it's often been untold. Family members come to us and tell us normally they haven't spoke to anyone before they had this opportunity to talk about their experience. And it's all about being able to listen and hear the story in a non-judgmental way. Step 2 is about trying to provide very specific information that's going to be very useful for that family to help them understand what they're facing, help them make sense of what's happening in the context of the family life. Information about drugs, about dependence, anything that the family member might want to talk about. The third step is all about interactions and how family members respond to addiction problem in the family setting. And we find that every time a family member is trying to respond, they experience dilemmas. You know, shall I do this? Shall I do the other? You know, there's always positives and negatives, and it's just helping the family member think through those options that we find is helpful. We then, in the 4th step, look at the social support that family members experience and how they can enhance that. And the 5th step is very much about looking for other sources of help and support that might be helpful beyond that 5-step contact with the person delivering it. In the remaining of the DVD, we're going to be seeing some examples of how this can be delivered in real life services in practical settings, and I hope those are going to be very useful. And we've got some really excellent examples in the